of aid, would you welcome Status Quo?
All around me are familiar faces, worn out places, worn out.
The United States government utilizes cutting-edge technology and science to save lives globally. The United States government determines where they distribute aid to improve global health based on a country's wealth, technical needs, and strategic interest in the country and relationship with its government. The United States government provides global health aid to countries worldwide. The government determines which countries receive aid based on countries with the poorest economies, such as Haiti, countries the United States is strategically interested in, Egypt, India, and China, and countries requiring the most assistance, like sub-Saharan African countries. Government priorities include helping the poor, women, children, and chronically ill. The United States government provides most of its global health aid to sub-Saharan African countries to prevent the spread of HIV, AIDS, malaria, tuberculosis, yellow fever, measles, tropical diseases, cholera, infectious diseases, and non-communicable diseases. The government funds China, India, and Egypt. China receives aid in the form of food safety, drug safety, and the prevention of infectious diseases. The United States helps India develop vaccines, drugs, and medical equipment. The government assists Egypt in preventing infectious diseases and malnutrition, strengthening family planning programs, and improving healthcare systems. Forms of aid include healthcare services, hospitals, clinics, and laboratories, maternal and child care health, reproductive health and family planning, and nutrition and environmental health, nutrition and sanitation. The number of government agencies providing global health aid has increased significantly over the years. United States global health assistance rose from $4.36 billion in 2004 to $9.64 billion in 2008. However, this was still only 1% of the government's federal budget. There are many government organizations and initiatives that provide aid.
Out faces, bright and early for their daily races, going nowhere, going nowhere. Their tears are filling up their glasses, no expression, no expression. Hide my head.
President Obama called for an increase in spending on global health from $7.8 billion to $8.7 billion. Within the past decade, the amount of money spent by the government on improving global health has increased and hopefully will continue to increase in the future. The economic strength of a country is a factor the United States considers when deciding who receives health funding. Wealthier countries have healthier people. Countries with poor economies have the worst health conditions. There are three main factors considered when the government determines if they should give health aid.
Tomorrow, no tomorrow. And I find it kind of funny, I find it kind of sad, the dreams in which I'm
Countries with poor economies, such as sub-Saharan Ethiopia and the Democratic Republic of the Congo, are funded by the United States government.
Sub-Saharan Africa has almost 1/4 of the world's burden of disease, but fewer than 5% of the world's healthcare workers. This healthcare gap has affected no country more than Ethiopia, where in the early 1990s, nearly half of its 76 million people had no access to even minimal health care.
If the United States can help create better economies in other countries, their continued future development will benefit us. A better economy leads to more stable nations and fewer extreme health issues. Haiti is one of the poorest nations in the world. Their economy lacks the funds needed to improve health conditions. The United States hopes to maintain a good relationship with Haiti by providing funding. The geographic location of a country helps determine if the United States government will contribute aid to improve individuals' health. The United States provides health assistance to countries such as India, China, and Egypt, where assistance will contribute to a positive relationship between the United States and the country. India is one of the United States' important trade partners and valuable source of investment. The United States government wants to maintain a good relationship with India. India receives aid to develop vaccines, train healthcare workers, and prevent the spread of infectious diseases. The United States government benefits by maintaining a trade relationship. Aid is given to China to protect and promote United States interests abroad. Supplying aid helps prevent huge outbreaks of pandemics and infectious diseases that could affect other parts of the world. It is in the best interests of the United States government to aid China. The government's relationship with Egypt is important. Egypt is one of the United States' key partners in ensuring stability in the Middle East and offsetting terrorism. The United States government aids countries in need of sufficient medical equipment, trained medical workers, and advanced medicine. Inadequate health systems are caused by few trained medical technicians and doctors, overcrowded hospitals, and scarce medicine. Africa has the greatest need. In many parts of Africa, there are shortages and limited supplies of medicine. Newer medicines to prevent cancer and other diseases are either not available or too expensive. Healthcare funding is used to build clinics and hospitals. Even if countries possess the technology, they often lack trained personnel to operate the equipment. The United States has started training programs to increase the number of skilled medical workers. Many hospitals in developing countries cannot afford essential medical supplies. Many hospitals are overcrowded and do not have enough beds to properly care for their patients. Developing countries lack the resources and technology to develop medicines. Access to medicine is crucial to improve a country's health because medicine prevents diseases and greatly increases a person's chance of survival. A priority of the United States government is to fund countries with devastated economies. If the government continues to set aside money for funding global health in the future, the quality of health in poor parts of the world will improve. Technological advances will lead to an increased supply of available medicine. Future funding to improve global health aid will decrease poverty. If the United States government's funding for global health dries up, the government will no longer play a role in decreasing worldwide mortality rates. Countries without the resources will have to rely on private organizations in the United States or governmental and private aid from other countries. Increasing health care in developing countries helps fight poverty worldwide.
You're the best I've ever had. I find it hard to tell you, I find it hard to take. When people run in circles, it's a very, very